السلام عليكم ورحمة الله وبركاته. يعطيكم ألف عافية ورجعنا مع بعض بحلقة جديدة من مع طلال. صراحة المرة الحلقة هي الحلقة الأخيرة. بتحياتي بلش دغري الدكتور مازن دوماني، بوجه له تحية كتير كبيرة. دكتور مازن دوماني، وجب أني أشكركم بآخر حلقة لمجموعة طب أسنان مباشر على دعمكم وعلى تواصلكم معنا خلال هالمسيرة الطويلة اللي هي 20 حلقة. صراحة يعني لما عم برجع هيك للذاكرة وكيف طلعت الفكرة وكيف فعلا هلا نحن اليوم امام الحلقه ال20، بحمد الله وبشكره بالدرجه الاولى، لانه صراحه هذا كله توفيق من رب العالمين حتى قدرنا نوصل لهالمرحله هي من محاوله انه نكون قدر الامكان حاول قدر الامكان انه نكون مفيدين من خلال استضافه العديد من الاساتذه والزملاء وفعلا الفنانين في مجال اختصاص مداواة الاسنان اللبيه، اللي بشكرهم واحد واحد على دعمهم ووجودهم معي. وكمان بدي اتشكر صراحه انتم، يعني لما انا بيكون في هالمتابعه وهالحرص الشديد جدا على متابعه هالحلقات اللي بتمنى مثل ما قلت لكم يكون فيها الفائده الكبيره، برجع بقول شغله كثير مهمه، انه احنا ما كنت استمريت لولا دعمكم ولولا وجودكم جنبي، وهذا الشيء صراحه بشكركم بعد شكر الله سبحانه وتعالى. طبعا الفكره الاساسيه اللي انا بدي اتشكركم فيها وما بدي اطول، انه كثير كم كبير من التواصل سواء على العام ولا على الخاص عم يقول لي ليش الحلقه الاخيره وليش مو تكمل والى اخره. صراحه يعني اي شيء له بدايه وله نهايه، واتمنى انه يترك اثر والاثر يستمر مع المرور الاجيال. طبعا الحلقات موجوده على منصه الفيسبوك، وايضا انا عم بعمل لهم ابلود بشكل تدريجي على صفحه على اليوتيوب شانل تبعي، فيكم ترجعوا لهم باي وقت، فيكم تعملوا لهم داونلود تستفيدوا منهم باي وقت. لكن انا يعني يمكن هو خبر ما حلو للبعض انه نحن ما حنستمر بمع طلال بسلسله كيس ديسكشن، بس الخبر الحلو انه مع طلال هو عباره عن سلسله من السلاسل. يعني سلسله كيس ديسكشن كانت هي اول وحده وهي خلصت معنا، وان شاء الله تكونوا استفدتوا منها، وراح يكون في عندنا سلسله جديده قريبا بعلن لكم عليها ايضا ضمن عنوان مع طلال. طبعا انا قبل ما بلش مع ضيفنا البروف الكبير يوشي تيروشي، حابب اتشكر بالاسم واحد اللي كانوا معي بالحلقات. اول شكر بشكره الدكتور عثمان العاني من العراق، وكاننا بحاله كثير حلوه، يعني كانت على الام بي 2 صراحه. الاحمد عز ايضا من مصر اخي العزيز، حكينا ايضا على الاداه المكسوره والبيرفوريشن كيف عمل مانجمنت الكيس. بروفيسورنا واستاذنا الكبير الاستاذ دكتور ادمون كويس من لبنان ايضا حكى لنا على السي شيب، كيف نعمل اوبتوريشن للسي شيب، كانت حلقه كثير مميزه. ايضا دكتور علاء يونس من الاردن حكى لنا على علاج الضواحك العلويه بثري كانالز. ايضا دكتور ابراهيم عمرو من فلسطين كان الحلقه الرابعه، علاء يونس بالحلقه حكى لنا كمان عن الليدج. اليوم حنحكي عن الليدج بشكل مستفيض وحسب التكنيك الجديد تبع الدكتور يوشي. ايضا كان معي الدكتور كلاوديو فرنرارو بالحلقه السابعه من ايطاليا، حكينا على المانجمنت اوف ديفيكولت اناتومي. وايضا حكينا مع كرار او مع الدكتور وليد شوعي من اليمن، ايضا وجه له تحيه. كمان حكينا على معالجه الارحاء الثالثه، عم بحاول اتذكر ان شاء الله ما اكون نسيان، الابر ثيرد مولر. وايضا كرار من العراق حكينا على الريستوريشن اوف اندودونتيكلي تريتد تيث. محمد حمو صديقي بوجه له تحيه ايضا من الاردن، حكينا وقتها على المانجمنت اوف ديفيكولت كيس والريتريتمنت وما نفقد الامل. الدكتور محمد صلاح ايضا من مصر حكى لنا على بيرفوريشن لارج بيرفوريشن. ايضا دكتور سعدو من فلسطين، سعدو بوجه له تحيه، ايضا حكى لنا على التريتمنت اوف لارج بيرابيكال ليجن. مارك حبيب على الاوبن ابيكس من لبنان. انطونيو شينيوتس من الحلقه 15 كنا مع من اليونان، حكى لنا على السي شيب باللور بريمولرز. محمد دوله من اليمن وقتها حبينا عملنا اوبن ديسكشن. وايضا عبد الرحمن توفيق حكى لنا على البري اندو بيلد اب والديب مارجنال اليفيشن. محمد دكاك صديقي واخي بوجه له تحيه، ايضا حكى لنا على اللارج بيرابيكال ليجن. وفاتني ايضا اخي وحبيبي الدكتور زاهر تقي، كنا بالحلقه العاشره ايضا حكينا على موضوع كثير مهم انا وزاهر تقي، على موضوع اخذ القرار امتى بنعمل ريتريتمنت وامتى ما بنعمل ريتريتمنت. حلقه مميزه بتمناكم تحضروها. اياد غنيم اخي العزيز من فلسطين ومن سوريا ايضا حكينا حلقه كثير مهمه كانت على الكراون لينثنينج. اليوم ما حطول عليكم، حنتابع والحلقه الاخيره مع البروفيسور يوشي تيروشي، اللي كلكم تعرفوا اكيد البروفيسور يوشي تيروشي. البروفيسور يوشي تيروشي اشهر من نار على علم. هو حصل على الدكتوراه في مداواة الأسنان اللبية بال 2007، وهو استاذ في كلية طب الأسنان بطوكيو ميديكال اند دنتال يونيفرسيتي، adjunct professor at Boston University. ايضا he's well known in the management of a broken file, وايضا ledge and management of difficult cases. He authored a lot of articles, published a lot of articles, and authored a lot of chapters in very famous endodontic books like Pathways of the Pulp. And he has a practice limited to endodontics in his clinic in Tokyo, and he is well-known keynote speaker in everywhere in the world. Please welcome with me Professor Yوشي تيروشي. Welcome, my friend.
Thank you very much, Talal. It's my great honor to be a part of your case presentation, and this is the last episode, so I'm very much honored to be with you in this session. Thank you very much. The title of my
first, before starting, I would like also, I missed something in your CV actually, that you love Ferrari.
Oh, yes. Thank you for mentioning that. Yes.
I have to mention this. So again, going through to our clinical case, which will be about the ledge management, and Professor Yوشي is going to describe his own technique about how to manage the ledge with the use of special instruments. So I will add your slides. We are all ears, dear Professor. So allow me to interrupt you every when and how in order to make more discussion about the case. Maybe you don't see me, but you can hear me. And keep following me on WhatsApp just in case if we lose any connection. Please go ahead.
Okay, thank you very much. So let's start. So I will talk about how to bypass the ledge. And if you have any questions, and I will always answer the question. And there are actually 4 techniques that you can use to bypass the ledge. One is hand instrument. The second one is 90-degree OGP mode from monitor, Trio ZX2. Or you can just simply rotate the file very slowly at 100 RPM or less. Or you can do the T mode and bypass the ledge. So I will just pick up the last 2 techniques, slow rotation and the 90-degree T mode. So this is the third technique that I want to show you to bypass the ledge. So if you can simply rotate the file pre-curved at 100 RPM, and you can use an up and down motion very slowly, then you can bypass the ledge. So this is a very simple technique if you have a ledge and if you want to bypass the ledge. So let me just simply show you the video so you will understand how to manage the ledge. So this is a video. If you rotate the file at higher speed, like at 2000 RPM, it's too fast. So it's not good. So this is a ledge, and it's too fast. So if you rotate the file at 1000 RPM, it's still too fast. You cannot get into the original canal. As you can see, I'm stuck in the ledge. How about 500 RPM? Do you think you can get into the original canal? No, 500 RPM is still too fast to get into the original canal. How about 300 RPM? Is this slow enough to get into the original canal? I don't think so. As you can see, I cannot get into the original canal. So you have to slow down to 100 RPM. How about this? If you rotate the file at 100 RPM, then you can get into the original canal. So if you pre-curve the file and you rotate the file at 100 RPM, you can easily, predictably bypass the ledge.
Allow me, Professor, to interrupt you. Very
Yes.
clear. We understand that the speed 100 RPM is very important in order to get a catch while we are rotating. But here I want to emphasize about the type of metal of rotary files. Can we bend any rotary file, austenitic file, or heat-treated file? What is your
Yes,
when you bend it, it will go back to its original shape?
I recommend you use martensitic nickel titanium file so you can maintain the precurve. If you use austenitic file, it's very dangerous. You can actually fracture the file because, as you know, austenitic file is very rigid and it's not good. So I prefer to use a martensitic file and precurved.
Okay. On the other hand, we know that martensitic file, which means that we have the heat-treated file, that are bendable. You can bend it. But we know that in the market, we have very soft heat-treated martensitic file. And also we can understand that sometimes we have some file that you can bend it, but they are not so soft. Because I'm afraid sometimes the soft will be deformed inside the root canal. Is there any brand or any recommendation by choosing between the martensitic file?
It depends on the AF temperature, austenitic finish temperature. So I want austenitic finish temperature to be more than 50 degrees centigrade. So it doesn't go back to the austenitic phase.
Okay. So let's go forward, my friend.
Okay, sure.
Continue with the discussion.
Okay. So this is a fourth technique that I want to show you. So you can just use a T mode of the AI motor. So with the T mode, you can click on it, then you can use reciprocating motion, 90 degrees. Then another click will bring you to whatever rotation you want. For example, if you just rotate the file clockwise, you can use that. Or if you want to reciprocate the file, like 90 degrees, you can do that too. So I always use the 90-degree reciprocating motion first until I get into the original canal. Then you can, once you are in the original canal, you can click on it. Then you can use a clockwise rotation. So let me show you how you do that. So for example, if you have a ledge beyond the curvature that you cannot see, and then you can first precurve the file, then use a T mode, reciprocating motion, 90 degrees. Then you will see the tip of the file climbing up the wall. Then you can get into the original canal. You can see that actually in a plastic block. So let me show you. And another thing very important is the file that you use must have biconical tip, because if there are three kinds of tip designs, one is pyramid, the second one is conical, the third one is biconical. And if you use a file with a pyramid, this is very, very aggressive. However, if you use a file with a biconical tip, you can easily get over the canal irregularities or maybe the ledge, and there's no problem using this kind of file. So let me just quickly show you how to let me show you the difference between the file with a biconical tip and the file with conical tip. It's a big difference. So this is the file with a conical tip. So as you can see, the ledge is getting bigger and bigger. Here, if you continue rotating the file, the ledge is getting bigger and bigger because of the conical tip. So you can be very aggressive using the file with a conical tip. However, if you use the file with a biconical tip, it's okay. you can reach the apical foramen without creating a ledge. So let me show you how you do that. So this is a 45-degree curvature. This is a vortex screw with a conical tip. So as you can see, I'm rotating the file clockwise, and there is no ledge being created. However, if you don't use an up and down motion, you will end up fracturing the file. Make sure you use the up and down motion. So I'm almost reaching the apical foramen. However, you see the instrument fractured. So if you don't use the up and down motion, you will end up fracturing the file. So it's not good. So whenever you use a file with a biconical tip, you can avoid creating a ledge. However, you may fracture the file if you don't use an up and down motion.
And may I add something, dear Professor? Not knowing well the anatomy and estimating everything from the very beginning is also a contributing factor to have a ledges. And I remember one case I was treating today for the upper molar. The dentist, he was doing a retreatment, but he referred the case because he told me that he was not able to open the canals. But when I found that still we have a gataperca, but he was not able to go through it. Actually, he was creating a ledge. So, and not understanding the alignment of the roots and how to direct our hand and to understand where we have a curvature with improper use of the rotary file will also create a ledge.
Yes. So before you touch the tooth, you must know the degrees of the curvature. If it's more than 30 degrees, you have a greater chance of creating a ledge. And of course, you have to know the file that you are using. If it doesn't have a biconical tip, the chances will be increased of getting the ledge. But if you use reciprocating motion, you can prevent the ledge formation. So let me quickly show you how you do that. So this is a reciprocating motion. And this is the same file I used in the previous video. So
the conical.
Yes. So this is the file with the conical tip. However, if you use the reciprocating motion, you can reach the apical end without creating a ledge. So I've reached the apical end.
So is it heated treated, this file, my friend?
This is the TF with a conical tip.
Okay.
So if you use the reciprocating motion, you can prevent the ledge formation. So this is a T mode. So if you have a ledge like this, you can first use the 90-degree reciprocating motion with a pre-curved tip. So let me quickly show you how you do that. So this is the AI motor. The setting is this: 90-degree reciprocating motion called SGP. So this is SGP. As you can see, the tip of the file is climbing up the wall. Make sure you use an up and down motion. Once you are in the original canal, just rotate the file clockwise so you can be efficient in instrumenting the canal. Then
but you have to make your up and down motion, or you have to use a special handpiece to make a vertical movement?
I like to use my hand So I want to, move my hand to create an up and down motion. Then irrigate the canal and do the same until you reach the apical end.
Dear doctor, this is without any manual negotiation of the ledge?
No. So this is, I'm actually creating the apical patency.
Okay. So what about sometimes when we know that when we are treating with ledges or when we change the original direction of the canal, we have some blockage. We can speak about it. We will continue the case first.
Okay. So now I almost touching the apical framing. Now I've reached the apex. Then you can switch to a bigger instrument like this. This is the number 25 high flex EDM. So before the ledge, you just need to use the reciprocating motion. Once you are in the original canal, just use the rotation that you like to use. So this is a 3504 high flex CM file. So this is an up and down motion. I always use an up and down motion, especially for the canal with a curvature more than 30 degrees.
And for sure, brushing anti-curvature. I saw you brushing anti-curvature in order to make more straight line access for the file inside the root canal.
Yes, in addition to that, I always want to make a funnel shape.
Yes.
And also, this is a automatic.
Just before going forward, my friend,
Yes.
we have to highlight a very important issue that whenever we are doing this technique, we have to pay attention. Like we have to feel our file, to understand it, that it's now inside the canal, because in the reality we don't see plastic blocks. We are dealing with blinded, so we cannot see by our eyes the canal, but we have to understand that the file is forwarding just slowly. And can you elaborate more on this point, please?
Yes. Okay. Whenever you lose resistance, you are not in the original canal, or you are stuck in the ledge or something. So always feel sticky so that you can follow the path to the apical framing. So I always feel it. Unless you feel the resistance, maybe you are not instrumenting the original canal. This is very important.
Yes, very important, because if the dentist didn't realize that he's not in the original path of the canal and the file is bended, and he will push and will increase the speed to 2,500, so he for sure will refer the case for you in Tokyo to remove the broken file.
Yes. And the difference between when you are in the original canal or when you are before the original canal, you feel always sticky when you are in the original canal, but you don't feel sticky when you are in the ledge. There is no resistance. And to help you prevent the instrument fracture and the ledge formation, it's better to use the contra-angle head with a very short vertical stroke. So this is the new contra-angle head. So this is a normal contra-angle head. There's no vertical movement. However, if you use, this is a new contra-angle head. As you can see, this is the vertical stroke, very small vertical stroke, 0.5 millimeters. Like this.
So this is important for what, my friend? To prevent file separation, or to help in the bypass of the ledge?
Yes, both. You can prevent both instrument fracture and ledge formation with a vertical stroke.
in case if the dentist forget to make up and down motion and he stayed on the same level to prevent cyclic fatigue accumulation, so the handpiece by itself will be making up and down motion.
Yes,
This is the main idea.
Yes. And if you modify the file, as I told you, it's better to have the file with a biconical tip. But if you don't, you can just create a biconical tip. And these are the files with a biconical tip. So let me quickly show you how you bypass the ledge. So this is a 90-degree curvature. First, you have to enlarge the canal, create a funnel shape before you get around the curvature. So always use a brushing motion against the outer wall. So this is brushing against the outer wall, like this. So don't be in a hurry. You must enlarge the canal before you manage the ledge. Create a funnel shape. This is the most important.
Because when you don't enlarge the canal and it's very tight, if you bend the file, it will straighten again.
Yes, exactly. So you need a space to maintain the pre-curve. So that's why you have to enlarge the canal just before the ledge. So around the curvature, it's better to use a 60-02 high flex EDM in the martensitic phase. So this way you can prevent another ledge.
Yes, for sure, because Getz-Glidden will not be able to go for this curvature.
Yes, exactly. And this is a straight 2504 martensitic file. So you cannot get over the ledge. It's not good. So in order to get over the ledge, you need to pre-curve the tip like this. This is 2004 martensitic nickel titanium file.
You bend it up to 60 degrees almost.
Yes. So you need to pre-curve the tip according to the curvature. So you can see the tip climbing up the ledge into the original canal, like this. If you have a biconical tip, you can do this. Then I'm going to switch to a bigger instrument. So this is the second one, 2504. So as you can see, the tip climbing up the ledge into the original canal, like this. Because of the biconical tip, you can do this. First, use the 90-degree reciprocating motion. Once you are in the original canal, rotate the file in a normal way. This is 3004. If you don't pre-curve the tip, you cannot get over the ledge. Always pre-curve the tip. This is 3504. Now you are in the original canal.
And whenever you are increasing the size, you are actually removing the ledge.
Yes, exactly. So this is how you remove the ledge. And this is, I'm going to show you two cases, then I'm done. So this is the retreatment case. As you can see, big apical lesions, and you can see the double curvature. This is the first curvature, and this is the second curvature. You can see the ledge. So I use exactly the same technique to bypass the ledge. So I negotiated the canal first. I released the apical foramen, and this is the ledge. Then this is instrumentation, and this is MTA obturation. As you can see, the root canals was completely filled with MTA, in addition to the lateral canal or the ledge formation here. And this is 3 months post-op, and this is 36 months post-op showing nice periapical healing compared to the original radiograph like this. Okay, thank you very much for your time, and I hope you enjoyed it.
Thank you, my friend. Very clear, very straightforward. Maybe we're gonna have some questions in the coming minutes. Really, we're interested. Actually, it's a special technique invented by Professor Yoshi Teirushi, and I hope that you will everyone find it beneficial in your practice. But actually, one of the most questions came to the page. They want more elaboration, more to clarify the difference between the conical tips and the biconical tips, because at the end of the day, unfortunately, not all the dentists are aware of all the details for their rotary files. So maybe after you elaborate more, they will pay attention when they purchase any rotary file in order to go for biconical rather than going for conical. Can you more clarify?
Yes. Okay. The definition by conical tip is you see the two cones. This is can you see the image here?
Yes.
Can you see it? Okay. So this is the first cone, and this is the second cone. You need two cones on the tip. So I always need the two cones. So the first cone usually get over the ledge. The second cone usually remove the irregularities on the canal walls. So that's why you must have a file with a biconical tip. But if you look at the tip here, this is a conical tip. There is only single cone on the tip. If you look at the K file, the tip looks like a pyramid. There is no cone. So that's why if you use this file, you can be very, very aggressive. And it's easy to create a ledge with this kind of file.
Okay. Another question, my friend. Let me stop the sharing. Another friend, I believe it's clearly there's a difference. Some of the followers are asking what is the difference between your technique and the adaptive technique for Antonia Sheniotis, tactile adaptive TCA, tactile control. Yes, what is the difference?
Big difference, because TCA, when you okay, first in the TCA technique, you place a file into the root canal, and when you feel resistance, just rotate the file as you leave the canal. But in this technique, you just use unappendant motion with a reciprocating motion. So it's a big difference.
Okay, for sure, it's a very clear. Another follower, Dr. Anas Khan, my regards to you, Doctor, my friend. He's asking, is it more safer to try to bypass the ledge manually first to create a patency, then to go for your movement, or no need, you can go for it from the very beginning as a rotary, I mean?
Okay, if you are comfortable with a manual bypassing technique, you can do that. But it's more efficient to use automatic rotation technique, like reciprocating motion. So, initially, if you are not sure about your technique, maybe I recommend you use the manual technique, of course. But you must have at least two more techniques that you can use. The more techniques, the better you manage the bypassing cases.
For sure. And another question, we know that you mentioned bending 30 to 45, sometimes 60 degrees for the heat-treated file in order to get bypass. But what about the length of how many millimeters from the tip of the file? 1 millimeter, 2 millimeters? How many millimeters you have to bend?
Yes, that's a very good question. The tip should be bent 1 millimeter from the apical end, because if you bend the whole file, it doesn't work at all, because the tip is more influential to bypass the ledge. So that's why I keep telling you the tip design is most influential in ledge or ledge formation or fracturing the instrument.
Great. Allow me to add something very important after flaring the canal before trying to bypass a ledge. Also, it's I believe and I recommend also to agitate, to irrigate well and agitate well, because irrigation and agitation will sometimes move the backed debris at the original base of the canal, allowing for more easier penetration of the file while it's climbing by your very nice movement, dear professor.
Yes, it's very important to irrigate the canal. So that's why when I do this technique, I do this in the presence of EDTA or Q-mix 2-in-1, because EDTA removes debris, and that will prevent the another ledge formation.
Thank you very much. I think we answered most of the questions. If any new questions will appear, I would like kindly you to go through the page, and if you have time to answer for them, it will be really appreciated. I don't know what to say. You are a very big friend, big brother. I'm happy that we always see each other in the conferences. Maybe, and also on social media, and also I hope that in 2023 we are going, me and you, to meet in so many occasions. And I'm really glad you're very interesting presentation, and really it's very nice to end up with you, Professor Yoshi. I don't know if the connection is working, if you want to say anything before finalizing the episode.
Okay. There are many techniques. So whatever technique you are comfortable with using, just go ahead and keep the same way. And Talal, my dear friend, we lectured together many times, and so this is actually the first time.
My pleasure.
And I'm your last private guest. This is my great honor to be your last private guest in your series.
Thank you. Hope to host you in Syria. In Syria, hopefully, inshallah, we're gonna host you in Syria. Thank you very much.
Yes.
If you change your mind.
Yes, someday I will go to Syria. It's a what? By the way, is it safe or still dangerous?
Yes, for sure. For sure, it's safe. And so many speakers came to Syria, and hopefully you will be able also. We will find an occasion. It will be our pleasure to have you there.
Okay. I will definitely go there.
Again.
Thank you very much.
Hope to meet in the future, my friend.
Yes.
So, sorry for the connection. It's not going. Thank you, my friend, and hope to see you, to meet you again. And bye-bye for now.
Thank you very much. Have a nice day. Bye-bye.
باي. طبعا شكرا كثير للدكتور يوشي تيروشي على كل هالمعلومات اللي قدم لنا اياها. انا اخذ راحتي اليوم لانه اخر حلقه. شفت شويه ملاحظات انه ما عم نفهم الى اخره. يمكن حاعمل لكم هيك بس خلاصه صغيره هيك بدقيقتين لحتى ناخذ الزبده مثل ما بيقولوا. الفكره عندك ليدج، وسع كنالك بشكل جيد قبل ما تجرب تعمل باي باس. الفكره تبع الدكتور يوشي لا تروح بالمانيوال، ممكن تستعمل الاندو موتور اللي هو تي مود، اللي هو من تيروشي مود، اللي هو بيعمل لك حركتين. حركه بتعمل ريسبريكيشن، نعرف الفايل بيروح بيمين ويسار، ريسبريكيشن بدرجه 90 درجه. فهو لما بيروح يمين ويسار بدرجه 90 درجه، هو بيكون عم يتسلق، عم يطلع فوق الليدج. هلا لحتى يطلع فوق الليدج او ليطلع يقرب على الاوريجينال باس اوف ذا كانال، او انت ايدك بتعملها اب اند داون موشن، او بتكون جايب الهاند بيس اللي هي فيها فيرتيكال موشن، يعني هي بتطلع وبتنزل. فمع حركه بتكون السرعه يمين يسار بزاويه 90 100 دوره بالدقيقه مش اكثر، بتقدر تدخل. وهون احساسك بده يكون هو الفيصل لتحس انه راح الريزيستنس وفعلا دخلت بشيء طري اللي هو الكنال. ساعتها مجرد ما دخلت هي كبسه صغيره بس على الهاند بيس، يكون عندك كبسه صغيره، مجرد ما كبست الكبسه صغيره بتحول حركه الريسبريكيشن لحركه دوران. والفايلات اللي بيريكومندد هي البايكونيكال اللي هي بتكون لها مخروطين فوق بعض مش مخروط واحد. لذلك انت لما بتشتري الفايلات شوف الكروس سكشن تبعه وشوف الشيب تبعه وشوف الديزاين، مو غلط. لما تكون بايكونيكال يعني كونين فوق بعض هدول حيكونوا اسهل انه يعملوا باي باس. بعدين بتروح روتيشن او بتروح يا اخي ريسبريكيشن حسب السيستم، او اي تي ار ادابتيف تورك كنترول يعني او ريفرس. يعني صراحه الموضوع كثير كبير وان شاء الله يكون هيك في اوقات ثانيه بنحكي عليها. وبعدين بتقدر تعمل باي باس الليدج وبتوسع مبرد، وكل ما وسعت كل ما روحت الليدج. يعني هذا خليني اقول لك خلاصه المحاضره او ودائما بحاول انه يكون فيه الفائده للجميع. بتشكركم لمشاعركم، بتشكركم لكل هالوقت صراحه. يعني ما بتعرفوا قديش يعني التحضير للحلقه بياخذ جهد وتعب. الحمد لله الله سبحانه وتعالى قدرني اني قدرت وصلت لهون ب 20 حلقه. صراحه هو البرنامج خلق من رحم الكورونا ومن الازمه تبع الكورونا ولما قعدنا بالبيت، بس هذا كله انعكس بشكل ايجابي. يا رب الله يجعل فيها حسنه جاريه. دائما بقول لكم ادعوا لي ولا تنسوني بصالح الدعاء. ادعوا لوالدي الله يرحمه، وادعوا لكل مين توفى وانتقل للدار الاخره. وهون بترحم وبدي منكم دعوه وقرايه الفاتحه لروح الدكتور ولاء الملا الله يرحمه، اللي هو صمم لي كل التصاميم تبع البرنامج، اللي انا ناقشته على الفكره واعطاني الافكار واعطاني التصاميم تبعها، ولكن سبقنا وراح للعالم الاخر اللي نحن كلياتنا حنمشي ان شاء الله، بس نترك اثر طيب ونقدر نكون مناح ونقدر نعلم قد ما بنقدر اكثر واكثر. انطروني، ما حاعملكم هيك بدها هي موسيقى تصويريه وشويه هيك دموع. انطروني بسلسله جديده، تابعوني على الصفحه، عم حاول قدر الامكان بشكل مختلف بشكل متنوع اني اعطيكم معلومات على قد ما الله بيعطيني. حاعطيكم بسلسله ان شاء الله جديده حلوه كتير تستمتعوا فيها. ستي تيون. اخر شيء برجع بتشكر طب اسنان مباشر، وبتشكر كل مين حاضر معي بكيس ديسكشن مع طلال. وستي تيون لشيء جديد مع طلال. والله يعطيكم العافية ولا تنسوني من صالح دعائكم. والسلام عليكم ورحمة الله وبركاته. طلال النحلاوي.